Hello, Dr. Vikki Petersen here. I wanted to talk to you today about hiatal hernia surgery. This is a question we hear a lot from people calling in from all over the country and wondering, should they do surgery? Should they do a more natural program like ours? So I wanted to address that. A quick anatomy review. So what we have is the mouth is connected to your stomach via a tube called the esophagus, and your stomach is below what's called your diaphragm. So that's a sheet of muscle that you've got your heart and lungs above it and all your digestive organs below it. And what happens is that as you swallow your food and it goes down that tube called the esophagus, it passes through what's called a sphincter, which was just a little kind of valve that very intelligently opens when food needs to pass. And then when that food passes, it closes, and that prevents food from going the wrong way. So it's a one-way flow from your mouth down to your stomach. And not only is the esophagus having these little sphincters that make sure it's going the right way, but the diaphragm itself has the sphincter, all in the purpose of keeping food straight down into the stomach and then allowing that stomach to churn the food. And so what happens with a hiatal hernia, to varying degrees, is that the stomach can push up above the diaphragm, and then what happens is that you can get acid reflux, you can get reflux of food itself. So there's varying degrees. What happens with surgery is that it is typically recommended, and really should only be recommended, when 30% of your stomach, so a full third of your stomach, has risen above the diaphragm. Because then what happens is food can't, because it's above, the food can't stay in the stomach. Food is regurgitated, you can't digest. It's a pretty miserable experience. So by the time you've achieved that 30% or even greater of the stomach above the diaphragm, there's really no argument that surgery is the only recourse, because that stomach, instead of that kind of an opening of just the esophagus, which is a narrow tube, now you have this widened opening, and there's just no way for normal digestive function to occur. So surgery can be great. It comes in, and what the surgeon does is pulls the stomach back down to where it should be and closes, sews up that widened opening with, the hope that it's going to stay that way. And therein lies the problem. So if you're in the category of nobody's arguing the fact that surgery is the only recourse, okay. Obviously, surgeries are invasive and they have side effects, and there's some cautions associated with that. But sometimes you just have to do what you need to do, because life is miserable, you can't digest. And again, that's a pretty clear cut. I would like to say that if you don't follow up with other measures after the surgery, it's one thing to sort of close that opening, but remember, the stomach has been spasming and pushing up and widening that gap, widening that hole for a variety of reasons. And so the surgery, okay, good, close the hole, but we're all about root cause. You see, like, what's causing it? And if you don't remedy the reason why, it's going to come back. And that is exactly what research shows, is that a good 50% of the time it doesn't last, and people are right back to where they started, which again only makes sense if you're not getting to the root cause. So a doctor by the name of Ann Lydor, she published published in the JAMA Medical Journal. What she said is it really should be reserved for life-threatening conditions because the success rate is so poor. So that's something that, surgeons love to do surgery, and in many cases that's fine, but that follow-up is missing. It's almost like somebody who, had a heart attack, and they get the stent to open the artery, and okay, blood is flowing, and okay, great, that could be a nice life. You've got a life-threatening situation, and now that's been remedied with this stent. But again, if we don't get to that root cause of how did that artery get blocked, it's going to get blocked again. So it's the same thing with the stomach. The stomach had a reason for being in spasm, pushing up, opening that gap. And if you don't get to the reason why, even if you had the surgery, subsequent to the surgery, you have to take those actions. So surgery is not the be-all, end-all, unfortunately. And as I said, the recurrence is about 50%. So there's that's a flip of the coin of whether you're gonna need more surgery. The other thing I really want to mention is that we see a lot of patients who have had the surgery, and they had the surgery and the opening got sewed up, but because nothing else was done, what they report is, I had this surgery and I have all the same symptoms now as I did before the surgery. So why did I bother with the surgery? So these are the things to consider. So again, number one, if you have this 30% of your stomach above, food is regurgitating, you're not digesting, okay, good. Surgery might be, really the only thing to do at that time. But that's step one. Step two is to follow up with the reasons why that occurred so it doesn't keep recurring. So hopefully that makes sense. Because what we find is that stomach is in spasm and pushing up for a variety of reasons. It can be diet, it can be infections in the gut that are creating inflammation, it can be obesity, in the integrity of the abdominal muscles are not strong. People who have chronic constipation increases the pressure, what's called the intra-abdominal pressure in the bowels, and that's literally forcing everything up. So there's a variety of reasons of why this occurs, and if you don't fix that, it's just going to happen again. And surgery is a big deal, cost aside, and I know insurance loves to pay for surgery, and that's good from the cost perspective, but what are we really looking at here? We're looking at your long-term health. Those are the main things to consider. And just because, as I said, just a patient yesterday said, but my insurance will pay for it, so it's less out of pocket. And I get it, that sounds good. But if you knew that you were going through an invasive surgery always has risks. And as Dr. Lydor said, unless it's life-threatening, she wouldn't recommend it. Hopefully that the summary is clear. If you got to do it, okay, fine, but then we need to do the follow-up. If it's not that 30% of the stomach above the diaphragm, then likely you will respond much better and more stably to the type of work we do here at Root Cause, which is to get to the actual reason why this all occurred. Now, granted, surgery is, fast, you go in, it's done, and everything's fine. But when they tell you your surgery was successful, what they're talking about is we pulled the stomach down, we sewed up the opening, and that's considered a success. But what research shows is that as follow-up occurs on these patients, that's where the failure shows up, because it doesn't last. So hopefully that answers the question about surgery. We are always here to answer your particular questions, but surgery, I think, always should be reserved as a last resort. And for some people, you know, it's the right first step, but just don't forget the second step, and that's what we're here for. Or maybe you just don't need the surgery at all, and we can really remedy this completely without any surgery at all. So please reach out to us and let us know your personal questions. All our programs are individually created. They're very personal, because how you got to the situation of having a hiatal hernia, whether very mild or very small, or not, is, you know, that's your own journey. And the biggest reason we became the experts in hiatal hernia was that patients were told, okay, so you've got heart palpitations and you've got shortness of breath and you're feeling anxious and you can't sleep, you have acid reflux, or, you know, you have GERD, or regurgitation of your food, you know, et cetera, et cetera, et cetera. And by the way, none of that has anything to do with your hiatal hernia, because it's so small. And that's a falsehood. We have absolutely documented that a very small hiatal hernia, let alone a subclinical hiatal hernia, meaning that the stomach pushes up against the diaphragm, doesn't even go through, but just pushes up against it, is all enough to create this laundry list of about 20 different symptoms. So don't give up. Don't think that it's surgery or nothing, and don't be discouraged if your doctor said you're not a surgery candidate, because that's a good thing. There's plenty you can do to really remedy the situation. So reach out to us, give us a call at the clinic. The California clinic is 408-733-0400. And our website is rootcausemedicalclinics.com. We're here for you. We'll answer your questions and really figure out the best solution for you. And until next time, have great health, and let's get you to exactly that level of health you deserve, because you deserve it. And life should be fun and pleasant and have a body that's functioning optimally. So I'll see you soon.